Hi. Hi there. Why don't you come sit down with your feet hip width apart? We're going to start today's class with a bridge. Then we're going to do a little bit of a functional movement pattern with the bridge. And then we're going to step into creating mobility in the rib cage. Yep. So why don't you come on down and activate your big toes and tuck your chin under just a little bit, just to elongate the cervical spine. I'm going to close my eyes, push my big toes down, squeeze my inner thighs, tighten my butt cheek, curl that tailbone under, come into a posterior tilt, come up into the bridge. Oh, and welcome to Holistic Movement with me, episode 48, I think. And connect that rib cage to the pelvis. Keep that butt tight. Connect your butt to your hammies. And then calm your breath down. Go inward into your breath. Your breathing capacity and your residual volume is different than mine. So if I were to count my breaths with you, it'd probably be a little bit off. But we're into about 5 or 6 breaths so far. See, if you relax those shoulders, you don't really need the shoulders to support yourself here. It's mainly coming from the abdominal core and the butt core and the big toes core. But I'm relaxing the jaw core. Those are all part of the core. Let's do 3 more breaths. And then we're going to slowly come on down. We're going to straighten the legs out and let's rest here. Let's take a few breaths. Okay, now let's bend our knees again and feet are hip width apart. And before we even come into the next position, I just want you to practice. And I put the camera up higher so you can see this angle hopefully better. We're just going to reach our right arm over our left, kind of in a diagonal manner, and reach a little bit. But we're just doing it in a relaxing manner. And then we're going to bring the left arm up and reach to the right. We're just practicing that movement. And then feel how the back of your left shoulder feels when you reach your right arm over. And then feel how your right arm back of the shoulder feels. If it hurts, maybe this position is not for you. Not all positions are designed for you. So skip this one. Okay, you got that moving down. Now we're going to come up into a bridge. And then we're going to reach over with this right arm. We're going to put all our weight on our left shoulder. And then reach. Yep. And then come on back. Drop that right shoulder. Now we're going to reach the left arm. And so I'm pushing down with my left foot to help myself reach with this left arm. So I'm engaging my left butt cheek a little bit more than the right. So if you see my hand kind of moving a little bit weirdly, I don't have epilepsy. It's mosquitoes. There's no wind today, so a lot of freaking mosquitoes. And then we reach with that right arm. Yep. And we reach with the... Sorry, I just reached with the left arm. I said right. Reach with that right arm, pushing down with that right foot. And then reaching with that left arm. Yep. Engaging the anterior chain. Let's reach with the right. Yep. Reach with that left arm. Let's do one more. And then reaching with that right. Yep, I really like this one. Okay, come on down. I'm going to scoot down. Let's rest here. Let's take a few breaths here. It's kind of a functional bridge, a functional movement pattern. It's kind of like a primal movement pattern, I should say. Let's rest there. Here. Let's bend our right knees. Bring your left arm next to your left ear. Roll on over to your left-hand side. We're going to lie on our bellies. So, rib cage, thoracic mobility and strength. And hopefully my mic won't go out with my head down here. And I'm going to bring my arms out to the side. We're going to tighten our butt and our quads, and we're engaging our abdominal region in a circumferential manner to keep that stability, the anchor. And super easy, we're just going to lift the right arm up and rotate the ribcage to the right. Come down, and then if you want, you can push that right hand down, and then rotate the ribcage to the left. We're not letting the pelvis shift to the right or left, and your head is following with. So think, how can my ribcage move synergistically, but also independently of the lower back and the butt and the legs? So we are differentiating, because nothing occurs in isolation, even though I just said isolate. I just want you to think of just moving the rib cage and not the other parts of the body. And we're just rotating back and forth. Now, some people do this with the hands behind the neck. I'm not a fan of that because it puts pressure on the cervical spine, which we already live in a head forward society as it is. So why compound it? The breath. Let's inhale. Exhale, rotate. Inhale. Keep that butt and quads tight. Exhale, rotate the ribcage. Inhale, exhale. Sorry, I went too fast there. Inhale. Exhale, rotate. If your shoulders are hurting, lower the arms, bring them down. And then just rotate this way, the arm down a little bit. A little bit easier, not as much weight. Let's do one more on each side with the arms down like this. Okay, let's place the hands under the chin here. Let's just rest here instead of turning over onto our backs. And can you let your shoulders fall and your rib cage fall? And can you relax your butt and your quads? And then can you relax your pelvic floor? Okay, now we're going to bring both arms in front. Hopefully my hands won't go out of frame. I'm going to back up just a little bit here. And then I'm going to bring both palms forward. My arms are a little bit wider than shoulder width. And I'm going to bring my right arm down. And then I'm going to reach with my left arm to the right. And then I'm going to drop the left arm down and I'll reach with my right arm. Now, you can drop this hand if you want and just get a stretch, but I kind of want to lift. We're pushing this left hand down into the floor, but I'm reaching with this right arm and kind of tilting, rotating. Should say rotation, not tilt, although we are in a tilted spine here position, but we're rotating a little bit. It's side flexion. It's actually, if we were standing, it would just be side flexion. So I'm exhaling and reaching, and then inhaling, coming back to the other side. Exhale, reaching. Inhale. Exhale, reaching, keeping both butt cheeks and quads tight. Inhale. Exhale, reaching. I'm not letting my pelvis shift to the left and right. Inhale. Exhale, reaching. Yep, using the rib cage. So again, differentiating the rib cage from the lower back and the pelvis. Can you hear my inhale and exhale? Let's do one more. I'm staying in the back bend. You can see from this camera angle, I'm in a back bend. My chest is lifted. That's why it's so difficult for me to talk. Okay, come on back. Woo! That was tough for me to talk and move at the same time. Let's rest here. Do you feel your rib cage now being activated? Why don't we do one more set? I really like that position. So we're going to bring both arms up, arms out to the side again. Okay. We're going to tighten the butt and the quads. I'm going to reach my right arm down. You can place it on the floor if you want, and then reach with that left arm, and then bring the left arm down. Reach with that right arm. Inhale. Exhale, lengthen. Inhale. Exhale, lengthen. Inhale. Exhale, lengthen. I'm relaxing my face. I'm trying to concentrate on relaxing my face as much as possible. Inhale. Exhale, reach. Inhale. Exhale, reach. Inhale. Exhale, reach. Okay, come on back. Let's rest again. And then why don't we lie on our backs this time? Because we're going to come up into, of course, extension, folks. But I just want us to lie on our backs a little bit healthier for the spine. And just a quick reminder, if you're a belly sleeper, please refrain. It really fucks up your spine. There's no perfect position to sleep in, but ideally you want to lie on your back or sides. We move a lot when we sleep. It's normal. We have to. But lying on your belly really messes with you. Bend your right knee, bring your left arm next to your left ear, roll on over to your left-hand side. We're going to come lie on our bellies again. Because if you've been tuning in, you know one of my favorite words is twofery. We've been doing extension. Actually, the last 3 movements have been extension, and this one is extension as well. And we're going to strengthen the mid-back while we're doing it. We're going to strengthen the lower trapezius and come into extension. So we got a quadruple, hey? We're going to bring both arms next to our body. We're going to tighten both butt cheeks and our quads. And I'm going to pretend there's a string attached right in my mid-back. And I'm going to pull that string. Someone is behind me pulling that string and lifting my rib cage up. And then when I come up into this full extension, I call it flapping the wings. I'm going to squeeze those shoulder blades towards my mid-back, towards my spine. But I'm keeping, hopefully you can see from that angle, I'm trying my best not to let my rib cage move. It is moving a little bit because I'm flapping the wings, but I'm strengthening those lower traps. Think of this as kind of a row, a quick row. Trying to drop my shoulder blades a little bit there. Squeezing in, keeping that extension. Let's stay a little bit longer. Squeeze, 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 squeeze. Okay, let's come on down. Let's rest. We're going to do one more set. Yes, one more set, folks. Okay, let's come up again. Let's bring our arms next to our body. We're going to tighten. We're going to lengthen the toes, tighten the butt. Hopefully my body's straight. And that string's pulling my rib cage up. And we're just squeezing, bringing my head into a neutral position. Getting those full breaths. Squeeze, squeeze. Feeling that mid-back. With your eyes closed, squeezing those shoulder blades. Keep squeezing. Keep squeezing. Keep squeezing. Okay, let's come on down. Let's rest here for a tick. And then we're going to lie on our backs. We're all done. Wow, what a mid-back extravaganza. I should say back cavastranza. Okay, let's let your mid-back drop into the floor. And luckily I'm outside, so I can really got some birds flying over me, surrounded by nature, so I can really sink in to nature and let myself go to it, to the rhythm that is the pulse. See you next week.